Hello and welcome back to the Listening to Your Gut podcast. I am here today with a special guest. I am here with my friend Kendra, Dr. Kendra Jones, and she is going to be sharing so much incredible information with you today. We were just chatting before we started recording, and I know like basically nothing about all the different therapies that she does. And so she is going to be just such a wealth of knowledge for us in terms of learning more about acupuncture. We're going to talk about cupping. I love red light therapy, so we'll definitely dive into that too. So many things. So, welcome, Kendra, to the podcast.
Yeah, thank you for having me. I'm super excited to be here. One of my favorite
Yay!
podcasts. So this is
Hey,
really exciting for me.
well, yay. I'm so excited to have you on. And this is Kendra's first podcast, and she's doing amazing and she's going to be fantastic. So, Kendra, let's start off with like I've watched your journey getting your degree and, now to the point where you've got this standalone business. Take us back to like the beginnings of when did you decide that you wanted to go down this path and like fill us in on that journey of like getting to this point.
Yeah, for sure. Okay, I'm going to take you way back
Do it.
actually to
Yeah.
16 years old. So
Woo!
I had my first daughter when I was 16 years old. So just a baby. I was a baby, she was a baby. We were both babies. And something that I noticed was, when I would go to my doctor's visits and I would, just follow the traditional path of going and having a baby and a child and then taking the child to the pediatrician and all of the things that you had to do as a new parent.
Yeah.
I came to realize that nothing was ever really explained to me, and I never really felt like I had a choice in anything.
Yeah.
It was you're going to take this medicine and you're going to do this, and then you're going to go here and you have to come here. And so I started to look into more like holistic paths, more natural solutions, instead of having to call the doctor every single time something went wrong with my new baby. I was a 16-year-old on Google, like, natural remedies for cough, just like looking
Yeah.
up simple things. It just started really simple, what to do if the kid falls down, all of those things. So I became really interested kind of in that path. And I guess from there it just spiraled. I finished high school, I went to college, which is really exciting for a teen parent. So I went to college right out of high school. And I actually met another person who was an acupuncturist, and she was a doctor. And from there, I just became so in love with like the holistic medicine, the natural remedies, all of the just everything about that journey was just so interesting to me. And it really felt almost empowering. It gave me a sense of like, you know, I don't have to be under someone else's control. I can actually take control and make decisions for myself and do things for my family. So, um, to fast forward, I now have four children who I homeschool. I finished my degree in acupuncture. I got the doctorate. I did a lot of clinical studies, a lot of internships, was practicing in a few different areas. And then I just opened this brand new acupuncture business, and it's already thriving. We mostly cater to moms, women, people who want to become moms, children, anything along those lines. But we do see lots of other people, lots of husbands, men, grandpas, pretty much everyone you can think of comes to see us at some point. So it's been
I
a really great journey.
I love that. And I mean, I've told you this before, but I'm going to tell you again. Also known as, so Dr. Kendra Jones, also known as Superwoman. I mean, gosh, kids,
Feels like it.
yeah, juggling, going to school, then, opening up this business. That's just incredible. I am so excited for us to dive into all of what you do because, like you said, there's so many different things that you can support people with. And you see a variety of different people, but I also love that it sounds like predominantly your focus is, or a lot of your clients are women. So I love that. That's amazing. But I would love for you to share, let's just start with like acupuncture. Um, for someone who's like, man, I've heard of that. I've never done it, me. And, maybe potentially wants to do it. Also me, I want to do it. What would you say, like, what are the benefits of it? But also, how does one go about, like, I don't know, preparing their body or preparing mentally, for that experience?
Yeah, totally. So first off, acupuncture is tiny needles. Some people have no idea. They think, you're going to be using big needles, like you go and get a vaccine. It's totally not like that. It's a little tiny needle. So about the strand of a piece of hair, you could say. That's the
Sure.
size that the needle is.
Yeah.
So it shouldn't hurt. You may feel a little prick or a little sensation when it goes in every now and then, depending on where the spot is. But these are little tiny needles. So they're very gentle, very comfortable. It's very relaxing. It's not scary. So usually you'll go in, you'll talk to the acupuncturist, they'll kind of get an idea of what's going on, and from there they'll develop a treatment plan for you. So you'll determine where the needles are going to go. They'll kind of talk about that with you, let you know what to expect, what other maybe modalities we might throw in. We'll talk about that later, but
Yeah.
and just really get to know you, your body, what's going on, and then, like I said, make a treatment plan for what to do. So you're probably wondering, like, well, how do we make a treatment plan? Where do we put the needles? That sort of thing. So we're mainly targeting the central nervous system. So the nervous system runs through the body. If you think about it, you bang your knee and your stomach hurts sometimes, or you stub your toe and your head hurts. So I like to tell people, especially children and new people, it's kind of like that. It's kind of, you can think of like those reflexes that you have where, we might be using a point in the foot to target something that's going on in your head or your back or your neck or, something hormonally that's imbalanced. And so that's really where we start, making a treatment plan, explaining exactly what we're going to do, and then we'll usually begin.
Wow. And how long, like, if someone's coming in for acupuncture, how long is like a session? Does it
Yeah.
vary?
It does. It does vary. Usually you would say about an hour for an acupuncture session.
Okay.
It can vary depending on what we're doing. And like I said, we have those other modalities that we'll throw in sometimes. So if you have a sports injury, we might want to do some cupping to release the muscles first.
Okay.
Or if you're coming in for some sort of hormonal imbalance, we might want to do some moxa, which is like a warming technique that we use. And we'll do that like on the belly, that sort of thing. So it just really depends on what we're doing.
Okay,
I
cool.
think
And
Acupuncture is going crazy.
um
Interesting. Sorry.
no, you're good. You're good. Um okay, so another question I have related to acupuncture is I've heard people talk about acupressure too. So I know that obviously acupressure is not using the needles, but what would be, like, in my mind, I would say acupuncture would be more beneficial, or has more long-lasting effects. What's the difference between the two, and why would someone opt to go one way versus the other?
Sure. Yeah, you're totally right on that. So acupuncture is going to be a little bit more potent. So
Mhm.
depending on what's going on, you may need something a little more than acupressure. Maybe you have a headache. You can rub the point for your headache over and over, and it might decrease it a bit, but it's not really going to get to the root cause. It's not going to get more, on a deeper level there. So
Mhm.
using the acupuncture needles often I hear my baby crying, sorry. Oftentimes, with children, we'll use acupressure. So we have different tools that we can use, and those can really help us to treat the children on a more gentle way without having to use needles, especially, the first few visits.
Got it. Okay. And again, you also had mentioned cupping.
Yeah.
and moxa, and I mean we're going to dive into red light therapy too, but tell me more about cupping. Like you had mentioned you do that a lot often with people who maybe have like an injury from sports related injury. Um, but I would assume that not just athletes are getting this done as well. So like what are the benefits of cupping, and uh like where can you go with cupping? I feel like in terms of like on the body, I've seen, athletes mostly like with your shoulder area and like back, but I mean, is that primarily like the most common location is to do cupping on the back, or can you go like
Yeah, so we can do cupping on almost any muscle in the body. So it's really, we're getting deeper into the muscle. So if the muscle is very tense and it needs to be released, it can be much more efficient to use a cup, which is a little bit, you know, wider. It can cover more of a surface area and really get the blood flowing. So we'll often do that before we do acupuncture. So
okay.
we'll try to loosen up the muscle, move around the blood, that sort of thing. Really just get things going. And like you said, it's not just for someone who has a sports injury, but really any sort of muscle problem. So you're thinking like maybe pain. Even we can use it for things like cough, where the lungs are really
Oh,
tight and those are needing to be released. Just
yeah.
use it for any sort of muscular or lots of different things where we need to kind of just move the blood in the body and really get things flowing. You would say there would be a stagnation there. Anywhere where something's like really stuck, maybe bruised, the shoulder, the legs, the back. So yeah.
That's
We
cool.
do have two different kinds of cupping. So we can do what's called like regular cupping, which is like a suction. We'll just put that on, or we can do it with fire. We'll actually like light alcohol on fire and then swab it inside the cup, and the heat will create a suction onto the body.
Whoa.
And it doesn't hurt. It sounds scary. It looks really pretty, but it really helps. Usually when people have cupping, they feel immediate results. So
Oh,
any sort of pain that you have, your practitioner can decide if cupping is a good solution for you and go
wow.
from.
So I'm thinking like lower, like I often have lower back, um, pain, like just muscle wise back there. Would like cupping be potentially beneficial for like lower back muscle pain?
Yeah, for sure. Low back pain, even that pain, the sciatica pain that people
Okay.
get that kind of starts at the low back and then stems down the back of the legs. We'll use cupping for that a lot.
Okay.
Um, Cramps, shoulder pain, upper back pain, neck pain, any of those things really is going to benefit from cupping.
Okay, interesting. And I want to go back real quick to acupuncture. So, I mean, you said something that was really eye-opening for me, which is that cupping targets the muscles, and then that allows once we, release the tension in the muscles for blood to flow better. I'm getting the sense that all of this helps for blood to flow better, and then I'm assuming that this helps, the body regulate more, which means decreasing inflammation. But my question stems from acupuncture then is not targeting the muscles per se, but it's more so blood flow, like you said, right? Or
Yeah,
am
definitely. So acupuncture can do two different things. So we can use acupuncture needles to actually target the muscle. Sometimes we'll do like dry needling into the muscle, which is one technique that acupuncturists do. They'll go directly into the muscle and just really work that muscle. But a lot of times we're really targeting the nervous system. So
yeah,
points that maybe are not on the low back, but for the low back. So, for example, we have a point that's right behind the knee. So, directly in the center behind your knee, there's a point that's right there. And we would use that for low back pain. When you do that point, it usually takes that back pain away almost instantly. Almost every person that I've had on the table, I've inserted that point, and the low back pain goes from a 9, 10, whatever it is, all the way to a 0. It takes that back pain away. So we'll use what we call distal points, which are points that are kind of farther away, maybe on the hands, maybe on the feet, the wrists, the ankles. just different areas instead of going directly. But we do sometimes also go directly into the muscle and work on those too.
Wow. Yeah, I know you had said at the beginning that acupuncture is focused on the central nervous system, but I thank you so much for sharing even more in depth that connection with, like you said, the muscles as well. And so cool. Now I'm thinking, okay, I definitely have to do acupuncture, and I definitely need the point behind my knee to be focused on so that
Yes.
I feel that instantaneous gratification of it going away. That's amazing. And
Yeah, and we really like to get those instant results. And sometimes the first time you come to acupuncture, those results might not last more than a day.
hmm,
But if you're in chronic pain, you've had pain day after day, a day of relief is a lot. And then, the next time you come back, maybe it lasts a little bit longer. And after 4 or 5, maybe 6 visits, you'll be feeling much better. So,
that's incredible.
mhm.
I would love for you to share too. You had mentioned you have women that come in with hormonal imbalances that seek treatment. What are some of the like hormonal imbalances that they're coming in with that, maybe some of the listeners might resonate with and say, "Oh my God, that's me." And maybe this is my next step. I need to go in and do this.
Yeah, definitely. So first off, I specialize in infertility. So I treat a lot of people that are struggling with infertility. I
Mm,
do male infertility too. So usually I'll work with both partners and we'll get a treatment plan and we will just dive into kind of everything that there is to know about that person's hormones, their menstrual cycle, what's going on, whether it's heavy periods, no period at all, what it just anything that's really seeming imbalanced. It can be the little things like having trouble falling asleep at night. And
yeah.
they oftentimes don't realize that it's hormonal related. It's really related directly to their hormones and where they're at. Hormonal headaches, acne, any of those, little flags that you might see, we're really good at treating those and getting to the bottom of exactly what it is and what's going on. So we don't diagnose in the same way Western medicine practitioners diagnose. So I'm not going to tell you, you have high progesterone. But what we do is we just target each symptom
Yeah.
based on the pattern that it's presenting.
Wow. That is incredible. Wow.
Yeah, it is. It's really awesome. And it's definitely really amazing because you can often see results, like you said, like instant.
Yeah.
And so for people to have those results, maybe they've been suffering from constipation and they're like, yeah, it's fixed. Like what happened? And those hormonal headaches, the acne, like a lot of those things will just start disappearing and really we're targeting the whole person. So we're looking at the whole body. So we do a in-depth exam every time you come. We ask you about your diet, your sleep, your health, your emotional status, how you're feeling, whether you have depression, anxiety, whether you're too joyful, too anxious, just really a lot of everything. So we want to know it all.
I love that. And I love how you've shared earlier too that you're treating the whole being, right?
Yeah.
Like you just said, you're targeting all these key factors and making sure that like when you come in, we're helping to potentially get you out of, a state of feeling, lonely or depressed. Doesn't mean maybe it's not going to go completely away, but you're helping to like alleviate
Yeah.
some of those symptoms. And so I would love to know, in terms of the clients that you have had, um, has anyone shared with you in terms of, maybe they came in feeling very anxious and then by the time they leave, they're not as anxious or maybe not anxious at all. Like I would love to know some of those kind of um, pieces of feedback that you've gained from clients.
Yeah, so once a month, actually, we do something called an acupuncture mini session where we solely do mental health. So
Wow.
I'll have people come in, we'll target stress, anxiety, depression, sleep,
Yeah.
and almost every single one of those patients that leave says they're leaving feeling relaxed, much better, they're ready for their day, they're less anxious. They can concentrate better, they have a clear mind. So like I said, it's really great at targeting the nervous system. And a lot of times people are in that fight or flight mode. There's so much stress in the outside world, so much information coming at us all of the time, scary news, just all of the things. And just really being able to reset from that and kind of get your body out of that fight or flight mode is so important. And acupuncture is great for that. So,
I
yeah,
love that. Gosh, I can't wait to take a trip.
sold, right?
Yeah, I can't wait to take a trip up to you. It's
Yes,
gonna be I need to fly there.
I
Um,
know.
but it's gonna happen. I'm gonna come to you because I want you to do it.
Definitely. It always feels like one of those like best kept secrets. And I try to share with everyone because I really feel like everyone should have access to this and be able to experience it. And it's well known to a point, but it's not easily accessible for everyone. There
Yeah,
aren't like acupuncturists on every corner. I mean, maybe if you live in like New York City, but everywhere else, it's kind of a low-lying undercover thing, it seems like. So I really love just educating people and telling people how this can help them and just giving them a chance to, like I said, be able to help themselves. That's
I love
very important to me.
absolutely. I can see the passion that you have for it. I mean, it's clearly evident in all of the training that you've done and just the
Yeah.
commitment and dedication all the way through, to this point where you have your standalone facility. Um, I hope in the future that we have more access to these types of therapies because I feel like, I just recently went to physical therapy for my back and not once was acupuncture or anything of the sort like mentioned, and I would have loved to. There's no, I mean, I'm not trying to diss going to physical therapy, but
Yeah.
I would have been given the two options. I would have definitely wanted to go the acupuncture route versus, the long drawn out process of physical therapy. I mean, again, yes, there are plenty of benefits for that as well, but I don't know. I feel like, and I'm sure you can resonate with this too, but in our Western culture, we just because there's not enough we deem, as a society, information about, things like traditional Chinese medicine and, more of an Eastern approach that we just turn a blind eye to it. And it's like,
Yeah.
oh, we open your eyes to it because there is so much good that can come from it. And if we explored that, to your point, we'd see that we can probably cure ourselves a lot faster, but then also because it's so holistic, I feel like it helps you focus more on like, okay, now what else can I do for myself? Is my nutrition off? Okay, let's focus on that instead of going to physical therapy, not changing my nutrition, not changing, my movement patterns, not changing, what kind of input I'm giving myself in terms of, what I'm taking in mentally.
Yeah.
Um, I
Yeah,
feel
you're
like
never really getting to the root cause of the
no,
problem. It's
yeah,
almost like a band-aid.
right.
Just putting a band-aid on the back pain or just trying to get by for now. So
Such a
yeah, just
shame.
really we like to focus on getting to the root cause,
Yeah,
figuring out
I love
what
that.
maybe nutritional things or maybe you're not sleeping and your back hurts because you're tossing and turning all night or
Right,
we really try to figure out exactly what's going on. And this has been used for thousands of years, this medicine. So, people have been healing this way for a long time. It's not like a new age thing that we
right.
just came up with. This is
Yeah,
like, there's plenty of information, plenty of science on this.
yeah,
And a lot of people don't know, but insurance actually does cover acupuncture for many, many things. So
that's
almost any sort of pain disorder that you may have. It's possible that, even your health insurance that you have right now may cover acupuncture. So
that's
it's really
incredible.
great for everybody. I say anybody who can get in to see an acupuncturist, you'll benefit.
Yeah, this is a sign to advocate for that because
Yeah.
to your point, I didn't even know that, I think we need to. have people like you share that, potentially it can be covered so that we can then go in, armed with the knowledge of, hey, why don't I ask if this is not the first line of defense, so to speak, that they share with me, go ahead and ask, and
Yeah.
say, hey, would this be covered? Because this is the route I'd rather go, to support myself and to heal myself. So I love that.
Yeah,
Um,
and a lot of people end up at acupuncture after having
yeah,
tried everything else.
yeah,
I will get a patient like, I've tried physical therapy. I've gone to every single doctor. I've done everything for years, and this is my last resort. And they're shocked when they get those results because they're like, well, why didn't anybody mention this before?
right.
We're
Yeah.
really working on educating, the doctors in the area, work with some of the local chiropractors, the local pediatricians, just letting them know that we are here and we're available. And, if somebody's interested, we're happy to provide any information that they want to know and help them get started.
I love that. I love that. I know we deviated for a moment, but for a good reason. But I want to
Yeah.
come back to some of the other things that you do as well. So fill us in more on this moxa. You mentioned it earlier. I had to Google search that before we hopped on because I was like, what is that? But that sounds super interesting. So tell us what moxa is.
Okay, so moxa is actually the burning of an herb. So we burn the herb mugwort. It can be in many different forms. So there's stick moxa, which is kind of like loose leaves of moxa, and it's in a stick, and you would kind of light it on fire almost like an incense.
Okay.
And then you would hover it over the skin just to really warm the area. So the moxa penetrates a little bit deeper than normal smoke or a normal like a heating pad would. So we can get to the deeper layers of the muscle, just get really in there and kind of warm things up. And again, get the blood flowing, get everything moving. If you think about getting relief from something like a heating pad or a hot compress, so this will go a little bit deeper. It doesn't burn or anything. It's just very warm feeling.
Okay.
We also have moxa that we can put over top of the needle to help warm the needle up, and that'll do the same thing to allow the heat to enter into the body. And so moxa, we use it for many things, a lot of hormonal imbalances,
Okay.
anything where you would see some sort of cold pathogen, we would call it. So if you think of cold as being like tight and tense,
Mm.
maybe the person physically feels cold, or you have those cold hands, cold feet that a lot of women have.
Yep.
Yeah, the moxa is really great for all of those things.
That's me.
Yeah, cold
Cold
hands and feet,
hands.
cold feet.
Yep.
Yep,
I,
many,
I
many
would
women have that.
I would venture to say, do you have women that come in that have like, because I have hypothyroidism. Do you
Yeah.
see a lot of patients with like autoimmune?
Yeah, we have tons of autoimmune. It's so common now to have somebody come in with
No
a
doubt.
whole bunch of diagnoses. So
Yeah.
it's really just, figuring out, like I said, starting with each symptom and just checking off what we're going to do for each symptom one by one by one. And
Sure.
really, because if you think about it, two people can have the same, disorder or disease, and it presents so differently in each person.
Yeah.
So we really try to get to the root cause and
Yeah.
see exactly how it's presenting in this particular person, what the pattern is that's showing up in this person.
That is incredible. I am one, jealous, and two, just in awe because like I just need to experience this. What an incredible tool, you know?
Yeah. It's really amazing. It works so great, and it's so helpful for so many people. Really, like I would say life changing for people who have been
Oh,
struggling and they've gone
yeah.
to doctor after doctor, and they've tried home whatever, Google whatever,
Yeah.
new diets and all kinds of things. So just really helping them figure out an actual plan and a path to start feeling better. And that's ultimately the goal, is to feel better and be able to live your life the way that you
Sure.
want to.
For sure. Okay, we got to also talk about red light therapy.
Yes.
So I have an infrared, like in-home sauna that has red light. So I
Yeah.
I know how beneficial that is because when I go in there, Well, one, I'm sweating like a fiend in there, but when I come out, I feel like a different person. And I
Yes,
also
so
feel
much
like,
clearer.
yeah, and I feel less inflamed.
Yes,
So
totally.
tell me how you, first of all, share with us the benefits, but then also tell us how you use red light therapy in your
Yeah.
practice.
So we use red light therapy in, I would say, almost every treatment that we do. So
Okay.
we'll combine that with the red light therapy. It's just really, like I said, it goes back to getting things moving,
Yeah.
just really clearing out any of that stagnation in the body, any of the inflammation, any of the really stuckness that's going on in the body. So that red light therapy, like I said, it's going to warm the person up. It's going to get their blood flowing. It's great for things like seasonal depression, even just depression overall.
Yeah.
People that aren't getting lots of sunlight, just pain, all sorts of things. You'll really feel much better after red light therapy. So all of those are just a great addition to acupuncture. You'll come in, you'll lay on the table, you'll have acupuncture. Oftentimes you'll have red light therapy, moxa, cupping. It's just a really relaxing, gentle healing treatment.
I love that. And how do you use like with your red light, is it like I don't know, I'm envisioning maybe like a blanket or like a pad that goes over you or like what do you use when you're giving that red light therapy? How does that
Yeah,
work?
so I have a red light lamp that I use. So
Oh,
I'll usually target an area that
okay.
has a lot of needles or feet, belly, one of those areas, just kind of depending on what we're treating for. If it is something like back pain, we'll often, put some needles in the back and then we'll put the red light there to
Okay.
just really encourage everything to move and get going again.
Sure.
Oh
Wow.
yeah.
Oh my. And then also, okay, tell us more about like the herbal medicines that you use. I know you had mentioned what was it called? Wart or
Mugwort.
mugwort.
Mugwort is
Mugwort.
moxa. Yeah.
Yeah, okay.
Yeah, so I do also do herbal medicine. So herbal medicine is going to be used for anything from sleep to hormonal imbalances again to shoulder pain, back pain.
Yeah.
There's a herbal remedy for just about everything that you can think
Oh,
of. And so a lot of times we'll use these ancient formulas that were invented a long, long time before me. And they've been proven to work. They work very well. They're safe,
yeah.
which is a big thing. They often don't have the side effects that traditional medicine has, So it's much more gentle on the body, but you will see results. Usually we'll prescribe like granules. Sometimes we'll do like teas or loose herbs. Just really depends.
Wow. And do you, I'm assuming you put those together, like you make those
Yeah,
formulas.
so we can put them together. There are also like herbal dispensaries, so we can have them drop shipped to your house from the
Wow.
dispensaries. Lots of different options for those. And then there are some that are, like I said, those ancient formulas, they're kind of already formulated. They formulate them, and we can get them for you and write a prescription for you and have them again shipped to your house, or you can pick them up at the clinic.
Oh my goodness.
Yeah.
That
And
is
like I said, they're safe, they're effective, they work. Yeah.
wow. Oh my gosh. Okay, so tell us, because I'm also curious too, like what does a day in the life look like in your clinic?
Yeah. So I get to work and I usually set up and first patient comes in and we get going from there and just kind of dive into whatever it is for the day. So this morning I had an infertility patient come in. I then had someone who's been dealing with pain for a good amount of time. It just really depends on the day of what we're going to get. It's such a mixed bag. Do anything from cough to children with ADHD or
Wow.
depression, anxiety,
Yeah.
just really a big range of symptoms. And like I said, we target those symptoms individually as opposed to by diagnosis.
Mhm.
So, like I said, something like ADHD presents totally different in two different children. So, we're going
Sure.
to want to see, is this child sleeping? Are they eating? Are they able to function? Are they hyper? Are they lacking motivation. What exactly is going on? And that tells us much more than just ADHD or whatever the overhead diagnosis is. So just spending the day investigating each patient and getting to know them and getting to know their families and their life and their lifestyles and just offering real support to these patients and helping them to feel better. They come in pain and they walk out excited to go enjoy the rest of their Saturday. So it's really rewarding, really amazing. Networking and educating the community about acupuncture, all of those things are just amazing.
I
Something
love
I
that. I
really
mean, I can
enjoy.
tell. I can tell how
Yeah.
much it means to you, and I can only imagine walking out of there, being in your shoes, walking out of there and feeling like, wow, look at all the people that I helped today and like truly made an impact for.
Yeah,
I mean, I can
definitely.
also imagine probably every single person who comes in says to you, no one's ever cared for me the way that you do. Like, I mean, because most general practitioners, most like Western medicine doctors don't put in that level of effort. And
Yeah,
to our point, don't look at the root cause of things.
right.
Like you said, you're investigating, deep diving into what is going on so we can fix things,
Yeah, and
holistically.
each patient that comes in gets at least 20 minutes of just us chatting, us
Yeah,
investigating what's going on, them telling me how their week went and what they ate for breakfast and what they ate for lunch and what they're going to eat for dinner. Their activity, how they felt emotionally this weekend, that sort of thing. So
sure.
just really investigating. It's really a job of investigating. So
Yeah. And
yeah.
that's so neat to be able to, probably find similarities in what people bring up and like with all your clinical experience, think about like, okay, here's some of the things that we can do to support you because I've seen this type of situation come up before. Again, knowing that things present differently, but still having that background knowledge of like, okay, I've seen something similar to this, let's try this and then helping create that plan for each individual person has to be so incredible. I mean, there's not a good enough word. I'm just at awe to describe it, but it just has to be such like so empowering for the patient, but then for you too, because you're
Yeah.
seeing the difference that it makes in their lives.
Totally. And as acupuncturists, we get to really know these patterns that people have.
Yeah,
It's often times where somebody who has nightmares, they also have trouble falling asleep, and they also have cold hands and feet, and they often get dizzy when they stand up. And, they have low back pain, and all of these symptoms kind of end up correlating with each other. So we really get to know those patterns on a really deep level and know kind of what goes with what. We always know the next right question to ask you, I like to say.
that's
So,
incredible. Ah,
yeah.
I want to know also, I love the name of your practice, Radical Relaxation. How did you think of that? Or like did it just come to you? Like give me the deets on that.
Yeah, so I really love the word radical because
Yeah.
I feel like it's more than just your average, right? So
Mhm.
it's just more. So relaxation and just more than your average relaxation. So this is something that's just really life-changing, like I said, and I wanted to make sure that reflected in the name, and I think it does. So,
For sure does. I love that. And I would love to know too. I mean, I know you said that you are reaching out and trying to educate as many people and, institutions as possible. What are some of your hopes and dreams? And I know they will eventually become reality. What are like your next steps for just the impact of what you're doing, for people at far and wide?
yeah, so I actually work with a holistic wellness center. So we are very focused on mothers, babies. We're focused on really catering to new parents, people who want to become parents, women on their health journey, and just that underserved population that's often, just swept under the rug and left behind. So really just growing that practice is a big goal of mine, continuing to nurture the mothers, the women, just everyone in our community so that, we can all thrive and rely on each other and really have that village that everyone is looking for.
I love that. You are a godsend to this world. I mean, geez, the passion that exudes from you is just top notch, and I know that you are impacting so many people and will continue to do that. And I'm excited to see your practice continue to grow and evolve. And I can't wait to come and be one of your patients. That's gonna
Yes.
make that happen because I want Kendra to do some acupuncture for me. I'm so
Yes.
excited. Oh,
Yes. We will have to get you in for a visit.
yeah, for sure. Do you want to share any ways to contact you? I mean, I know you have your Instagram handle, and I will put that in the show notes, but is there anything you want to share with the listener in terms of ways to contact you or things of that nature?
Yeah, you can find me on thevillagemd.com. I'm also at Radical Relaxation on all social media. So you can find us on Facebook, Instagram. You can watch some cool videos of cupping, acupuncture. We do
Uh,
lots of educational videos.
uh,
So you can learn a little bit more about acupuncture and then find a local acupuncturist if I'm not local to you. Um, I really, like I said, I think acupuncture can be for everyone. So I encourage you to reach out to your local acupuncturist, ask them questions. We love answering questions. So, yeah.
yeah. Oh, well, Kendra, thank you so much for being on. This was so informative for me, so eye-opening for me, and just makes me excited to be able to, one, experience this for myself, but then two, continue to see this ripple effect of what you're doing impact so many people. So
Yeah.
thank
Thank
you.
you for having me. I'm so thankful to be here today.
Oh, absolutely.